Good morning.
Good morning, doctor. Good morning, good morning. Fine, good morning, doctor.
It gives me great pleasure to welcome Mr. Venkatachalam, a 67-year-old gentleman who is sitting here in front of me. He has come all the way from Sholingar, a divine place in Tamil Nadu, one of the 108 divine places of Lord Vishnu,
Divya Desam.
or called Divya Desham. So he's a very staunch believer and he has come all the way, and every time he comes, he brings me prasadam. So by the receipt of this packet, I can understand ahead of his staying whether he has got faith in me or not. So today I have received 2 packets of prasadam, and I trust that he is holding me in great stead, and also he is improving. So we'll hear from him, we will talk to him. Today is 36 days after his stem cell treatment of to the right knee and PRP treatment to the left knee. He had symptoms in both the legs. Now we will talk to him, and you will listen to him and hear about the results. வணக்கம் மிஸ்டர் பக்தவச்சலம்.
வணக்கம் சார். ஃபைன் சார், ஐ ஃபைன். நல்லா இருக்கேன் சார். உங்கள் ஆசீர்வாதத்தில் சர்ஜரி எல்லாம் நான் இப்போ நல்லா தெளிவாக அழகாக இருக்கேன் டாக்டர்.
ஸோ இன்னைக்கு 36 நாள் ஆகுது.
ஆமாம், இன்னைக்கு 5வது வாரம் டாக்டர்.
5வது வாரம் ஆகுது.
ஆமாம் டாக்டர்.
ஸோ ப்ரொசீஜர் பண்ண அப்புறம் இப்போ இது வரைக்கும் ஓவராலாக ரிசல்ட்டை பற்றி சொல்லுங்கள்.
ஓவராலாக டாக்டர்னாக்க ஆஃப்டர் சர்ஜரிக்கு பிறகு
சர்ஜரிக்கு முன்னாடி எவ்வளோ தூரம் நடக்க முடியும்?
ஒரு 2 furlong தான் டாக்டர் நடப்பேன். இப்போ மோர் தேன் 1 kilometer நடக்கிறேன் நான்.
You are able to walk more than
1 kilometer per day.
So you are able to walk for more than 2 kilometer, 1 kilometer.
1 kilometer per day. Definitely.
But before it was less.
Less. Only 2 furlongs.
Okay. So how much is your knee bending? காலை எவ்வளவு தூரம் மடிக்க முடியுது?
More than 100 degree I can bend it, doctor. Okay. Before that I could not be able to bend properly. After surgery, slowly and get the physiotherapy practice as per the doctor advice, and I followed that advice. And now more than 100 degree, I fold my right knee legs, sir, doctor.
How is the appearance of the knee?
Very fine.
Appearance எப்படி இருக்கு?
None is a fine, doctor.
கால் ஸ்ட்ரைட்டா இருக்கா?
It is a perfectly is a straight. It come on perfectly straight.
And is there any swelling?
Swelling is mostly reduced, doctor.
Mostly
reduced, doctor.
Okay. Because of the swelling, your knee was bent before.
Yes, doctor.
Now it is straight.
Now it's a straight, doctor.
And is there any warmth? Sooda irka?
No, doctor. No warmth, doctor. No
warmth is not there.
Not.
You have checked it yourself. Too.
Yes, doctor.
So what is the percentage of improvement pain-wise in the last 36 days?
More than 60%. The pain will reduce, doctor, now.
So where do you have this residual pain? You are a zoology man.
Yes, doctor.
So you know about the bones and all that.
Yes, doctor.
So you know the bones in all the animals and mammals.
Yes, doctor.
Tell me in which bone you are having pain now? Residual pain.
Yes. Now, doctor, the femur is perfectly all right, doctor.
Okay.
Now in the tibia, the weightage bone is the tibia below the knee. That particular place, not fully in the tibia. In particular, I got a small pain, doctor.
Small pain.
Small pain, doctor.
Okay. So what could be the reason of that pain?
Due to lack of vitamin D3, doctor.
How do you know that?
After testing my blood test, day before yesterday, I checked my vitamin D3, calcium, magnesium and vitamin K. I found out that particularly magnesium, as per doctor advice and given the tablets, I followed that. The vitamin calcium, magnesium is also in the correct level, but it's a lack of vitamin D3, I got pain, doctor, and it was happened due to vitamin D3. Doctor.
So you realize the importance of correcting the bone health also along with the joint health.
Yes, doctor. Yes, doctor.
Because if the bone is weak,
yes,
because the shock absorber is gone,
yes, doctor,
all the weight will come on the weak bones.
Yes, that's it.
And if the weak bone is there, that will crumble.
Yes, doctor. Yes.
Like Humpty Dumpty.
Yes, doctor. Amma, doctor. Yes, doctor. You are correct, doctor.
So now we are taking steps to strengthen the bone.
Yes, doctor.
So I have given you a prescription for vitamin D3,
magnesium, calcium and vitamin K.
Proper calcium, not all sorts of calcium. Calcium which will be absorbed.
Yes, doctor.
Irrespective of your diet.
Yes, doctor.
Because many calcium will not get absorbed if you eat green like kirai, spinach and all that.
Yes, doctor.
And carbonate.
Yes,
Food
doctor.
interferes with that.
Yes, doctor.
So it is important to take the correct prescription of calcium.
Yes, doctor.
And then when you are taking calcium, you want to take that calcium should go to the bone.
Yes, doctor.
Calcium should not stay in the blood or go to your heart. So you need to take other medicines, magnesium and potassium, and I've given you a prescription for that.
Yes, doctor.
So hopefully with the correction of the metabolic state or the strength of the bone,
yes, doctor,
you will continue to improve.
Certainly, doctor.
Certainly. I hope that it turns out to you.
Sure, doctor.
It materializes for you.
Yes, doctor.
So please follow up and come and report your state.
Certainly.
In the future also. Sure. Thanks for coming.
I shall always thanks to doctor. Now, Dr. A.K.Venkatachalam is not an orthosurgeon. Particularly myself is a God. I am actually prayed to God for Dr. Venkatachalam is health and a long life. I pray to God. Because not only I am recovered from the right knee, so many patients are waiting for the correct doctors. Who is the particular doctor? Proper doctors, so many people are not able to find out. But I found out through the YouTube and TV message. I don't know how to, once again, I don't know how to express my thanks to doctors. Now I am more than 80% I am happy. I am very happy. I record all my freedom, particular movements, walking and reduce the pain and reduce the bone loss and re-recovery of the damaged bones, knee also, sir. I feel that. What I told, I feel. I feel only what I feel, then only I say that. Thanks for coming and reporting your state. You have brought a gentleman here. He is also from the same place, I think. Rajashekar is my best friend as well. Is my relatives also. Relative also. Okay. It's so nice to see you. Thank you, doctor. So this is how I treat my patients. He will have a good first-hand account of how I deal with patients. Thanks for coming. We'll see you next time. Thank you, doctor. Thank you. Thank you, doctor. Thank you. If you want to see the previous testimonial of this patient soon after his surgery, you can find it linked up here. If you want to see more such videos, subscribe to my channel Madras Joint Replacement Center MJRC. Like, share and comment. I'll see you in the next video.